I am Dr. Kristy Guillen. I'm a pharmacist and diabetes educator. I support Mountain Valley Medical Center as well as Blue Ridge Family Practice. We have pharmacists in multiple primary care physician offices within the system. We have pharmacists at Table Rock Family Medicine, Lenore Family Medicine, Mountain Valley Medical Center, Blue Ridge Family, Drexel Medical, and McDowell Medical. Pharmacists have been placed in family practice setting to help with medication management and chronic disease state management. We're prepared with a lot of tools, and we have a doctorate level training which helps us care for the patients from a different perspective and really help the providers. Here at Blue Ridge Family, I primarily do diabetes management and also comprehensive medication management services, so helping patients identify barriers to getting their medicines, patient assistance programs, those type things. Having a pharmacist and diabetes educator right here within the practice is very convenient for patients. They don't have to be referred to a different site off location. They don't have to find a different place. Everything is done here, and I'm able to communicate directly with their provider to best tailor their therapy and really meet their needs in their most comfortable medical home environment. I have always known that I wanted to be in the medical field and a pharmacist. I had worked in a pharmacy since I was in high school, and it is definitely a calling for me to serve patients, and diabetes has always been a passion. Diabetes is an epidemic in this area especially. 1 in 11 people have diabetes, and it's estimated that 86 million people have prediabetes. And the thing is that most people, whether they have prediabetes or diabetes, they don't know. It's our job as the providers to really target those patients and provide them with the best care, because there's ways to prevent and treat those complications. There are 2 types of diabetes. In type 1, the body does not produce the insulin that you need, and in type 2 diabetes, you don't make enough insulin, or you just don't use it as efficiently anymore. And we are concerned about diabetes because it's not just a blood sugar issue. It affects your entire body. So patients with diabetes are more prone to stroke, heart attack, kidney disease, eye disease, and amputation. So it's a very serious problem facing our patients. And studies have shown that by us intervening with medicine, nutrition, and exercise, that we can make a big impact in the role of patients' diabetes care, as well as the prevention. So we really look at patients with pre-diabetes now, and we can, through different programs and lifestyle and diet modifications, reduce the incidence of type 2 diabetes by about 58% in those patients. So things that we can do on the front end to really prevent all of those long-term complications that we talked about. We have some new medicines that are available to patients, and so there's new classes of medications. There are injectable medicines now that are not insulin that can help control diabetes. So I think the most exciting part is we have more options for our patients. These are some insulins. This is a rapid-acting insulin used to cover food, mealtime. And then we have some long-acting insulins, and these are available in vials. The patient would use a syringe and draw the medicine out of this vial. We also have medications that are available in pen form that the patient can just dial up their dose and easily inject it. And they can carry these along with them. They're not tied to a vial and syringe at restaurants and everywhere. We definitely realize that nutrition and diet play a major role in the management of diabetes and prediabetes for that matter. We can help patients identify what are the best foods to eat to prevent and also manage their diabetes. We design a diet and nutrition plan that suits the patient and their lifestyle. We want to give the patient tools that they can use and that are attainable in their everyday life. What they do like, what they don't like, how to prepare foods that may be more palatable to their tastes, different options. Beverages, drinks, sodas, those are the main difficult part for most of our patients. Patients take in a ton of carbohydrates and calories just from their beverages. There are downsides to diet drinks. We used to tell patients, well, just convert from regular Coke to Diet Coke. And now we know that those drinks have different components in them that are hard on the kidneys. And so diabetes is also, already affects your kidneys, and we want to avoid that. Water is your best bet. There are many different things now that you can use to flavor your water, add to your water, lemon water, to make it work for you. For people with diabetes, it's recommended that you exercise 30 minutes a day, at least 5 days a week, and also incorporate some type of strength training exercises twice weekly. And exercise does not have to be going to a gym. It can be walking to the mailbox. And I always work with my patients to start with small goals and work their way up to those major goals that are going to get them to where they need to be. But walking around the grocery store, walking up the hill in your neighborhood, those things count. A lot of patients get discouraged and discount those types of activities. You have to find what you enjoy and what works for you. If it's an elderly female, a lot of times the resistance training for her may be lifting soup cans or carrying in groceries. Different things like that can impact. And what that does is it just increases their muscle mass a little bit and helps them use the insulin, especially with type 2 diabetes. Any insulin that they make, it helps them use that more efficiently.